These tests are not precise. Don't get a test if you're not going to do something differently with the information that you get back. Understand that you could get back a test that is inaccurate. It says you have the virus when you really don't. These inaccurate tests are really dangerous in a situation where we're trying to make important decisions based on that. Hi, my name is Jim Meehan. I'm a medical doctor, MD. I specialize in ocular inflammation and immunology. I'm also trained in preventive medicine and functional medicine. We're talking about COVID-19, the pandemic, and all of the confusing information that has come out. One of the areas of much confusion is in testing for this virus in patients. There's a couple of different tests that can give us either accurate or inaccurate information.
How could I or would I be positive after 2 negative tests within 2 weeks and all of a sudden I'm positive? That doesn't make any sense. So I asked the doctor, I said, well, can I test again? He said, no, once it's a one and done, and the false positive, it doesn't matter if it's a false positive. Once it reads, it reads. And
are there some incentives to have more cases reported? I think there are. I think that we've all heard the stories. Let's examine how that could happen. Because this is a new virus and we're in a pandemic, everything was urgent. The FDA allowed about 48 companies to produce tests, put them out on the market without adequate oversight. So we have a lot of tests that were never tested and confirmed to be accurate and precise in the laboratory like we would normally do in a non-emergency situation. These antibody tests, they're not very specific or sensitive. The ability of the test to detect the presence of the antibodies in your body has a rate that's about 34 to 80% sensitive. So that means that you could actually not have the presence of the antibody in your bloodstream, and the test would say that you do. So that we're getting a lot of those kind of false positive tests. All right, let's talk about the genetic test, what's called RT-PCR, to measure the presence of SARS-CoV-2 in the human body. Imagine that you have a picture of the coronavirus, and we're going to take that picture and we're going to turn it into a puzzle. It's a puzzle of 1,000 pieces. Now, one of those pieces matches up to, on that picture, the spike protein for coronavirus. Now, what we do with the genetic test is we try to find an exact match to that puzzle piece. It has a little shape to it, and our piece matches up to that exactly. That's our marker in the test. And then our marker is going to match up with that puzzle piece that is a small portion of that spike protein. And we're going to then replicate that. We're going to amplify that, make multiple copies so that we get enough copies that we can measure that and see that and visualize that in the lab. And then we can say, yes, you have this puzzle piece present in your body, you have a positive test. But also imagine that small little puzzle piece it looks really similar to a piece in other puzzles, other pictures of other viruses. The coronavirus family is a large family. The common cold is a coronavirus. We might be delivering some of these puzzle pieces in some of our vaccines. There's all kinds of different ways that we could get confused about that, detecting the presence of this puzzle piece that looks the same in other pictures. But that's the process that we use, and it can go wrong in a whole bunch of different ways. We can amplify that piece multiple times, too many times, and we're actually we're amplifying the picture of a different coronavirus and saying that you have SARS-CoV-2 when you may not, when it may not actually be present in your body. You get the wrong test result back, it's not what's happening in your body, and you do something that may cause you to lose your job, may cause you to have to quarantine and isolate for 2 weeks or more. And we really need better testing. And that's probably the most important thing that we call for now, is we need better, more accurate tests. We need the FDA to provide better oversight to make sure that we're only using the best, the most accurate test. And then you insist on getting only the best, most accurate test so that you can make the best, most accurate decisions for your health and what you do with the results of that testing.
You guys be the judge. No symptoms, no signs of anything. I tested positive. I can't I'm not supposed to travel for 14 days. Well, they said they'll give me 10 days since I have no symptoms. And if I actually take 2 negative tests before that, I can go, I can leave. I'm out of quarantine. So you be the judge.